Serotonin antidepressants, step aside, there's a new kid in town. The FDA just approved a new depression medication that I think will be revolutionary. It's not mushrooms yet, but we're close, or we're getting close. I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. Here's the story. In 2019, I did a video talking about how the science on the origins of depression is evolving from the old theory of a chemical imbalance to a model of changing altered nerve connections referred to as neuroplasticity. That was 2019. Neuroplasticity is the idea that for optimal brain function, it depends on the connections in the brain's nerve circuitry. And the brain has the capacity to modify those connections. So if we know that altered connections cause depression, why are we still using serotonin elevating medications? Because the downstream effect of those altered connections is that the nerves release less serotonin. So increasing your serotonin levels is still helpful, but it's really putting a Band-Aid over a wound. It doesn't address the upstream bad circuit problem. We also know that the antidepressants that we have work well for some, but there's a lot of people who don't respond to them, and many people have a lot of side effects that make the drugs hard to take. So researchers have been working hard and fast on medications that treat depression, but by a different mechanism and not just increasing serotonin. So here we have the new drug, Auvelity. Auvelity is a combination of dextromethorphan and bupropion. Dextromethorphan is an over-the-counter cough suppressant that is sometimes called DXM and has been sold under the brand name Robitussin. Bupropion is a dopamine and norepinephrine enhancing antidepressant sold under the brand name Wellbutrin. The presence of bupropion is not what treats your depression. It may help a little, but it's the cough suppressant that does the heavy lifting. Bupropion is there to increase how long DXM hangs around. Without bupropion, the dextromethorphan would wear off very quickly. Here's how the cough medicine helps depression. Dextromethorphan is an NMDA receptor blocker. Neuroplasticity relies on the NMDA receptors because these receptors rewire nerve circuits. So here we have a drug that works upstream at the wiring level. Still, how does this help with depression? I've talked in a previous video about the default mode network of your brain and how it's responsible for getting you stuck on negative thoughts. This network is a series of structures in your brain that gives you things to think about when your mind wanders and you're not intentionally thinking about something. It fills in the empty airspace for you, usually with something negative. When you are depressed, you tend to ruminate more on themes of hopelessness, helplessness, self-loathing, and regrets. Rumination is when you churn things over and over in your mind. Researchers have found that depressed people have tighter connections in the default mode network, but these tight connections aren't a good thing. It's like having a rigid wire mesh connected together to areas that lock you into these negative thoughts. Drugs that work on the NMDA receptor loosen the wiring in this area, freeing you from some of these negative thoughts. It also helps you get better control of your thoughts. So that's how this drug works. But here's the really good part about it. It works fast. Traditional antidepressants take a couple of weeks to a couple of months to see the maximum benefit. And part of the reason for that delay is the need to start at a low dose and build up to a dose that works. This drug has been shown in the trials to improve symptoms within a week, and the effect was sustained. That's pretty amazing. We have another drug that works this quickly called ketamine. It turns out ketamine is also an NMDA receptor blocker. Ketamine is in the class of drugs called dissociative hallucinogens. Dissociative hallucinogens create an altered state of reality, like feeling out of body and misperceiving spatial distances. Ketamine can wipe out your depression symptoms in a snap, but the problem has been access to getting it. Getting the IV or nasal form is expensive and requires frequent treatments because the effect wears off quickly. Even Spravato is not easy to take because of the restrictions and monitoring it requires. You can't take it home, and you have to go to your doctor's office and have someone drive you home afterwards. And by the way, other drugs that work at the NMDA receptor are PCP, which is an illicit substance also known as angel dust and is not used clinically, alcohol, and nitrous oxide, sometimes referred to as laughing gas. Your dentist may use nitrous oxide during a procedure. When you're under the influence, they can drill or pull your teeth, and you don't have a care in the world. It's like, hey, you can do whatever you like. But just like with ketamine, as soon as the nitrous wears off, it's back to reality. So here we have a drug that works as quickly as ketamine without the monitoring. I haven't yet seen when the drug will be available and how much it will cost. The amount of dextromethorphan in one tablet is 45 milligrams, and the expected dosage you'll need is 2 a day. You can't get the same effect by taking high doses of over-the-counter dextromethorphan, and I'm not just saying that so that the drug company that makes the pill can make money. This pill is unique because it's combined with bupropion, which slows the metabolism so that the effect doesn't wear off as quickly like it does with ketamine and nitrous oxide. In fact, dextromethorphan as the cough medicine has the potential for addiction if you abuse it by taking it often, like daily and at high doses. Watch this video for more on the default mode network and this one on the neuroplasticity model of depression. Thanks for watching. See you next time.